Welcome to the deep dive. In a world just packed with information, we try to cut through the noise and get to what really matters. And today, we're diving into something pretty fascinating happening in U.S. health sociology. It's this major shift, really, away from just looking at individuals towards understanding how social structures deeply shape our health.
Absolutely. And it's making the field, more vibrant, more theoretically engaged than it's been in a long time. It's really quite exciting.
Okay, so let's unpack this a bit. Historically, health sociology often used uh, methodological individualism, right? Focusing squarely on the person as the main unit of analysis.
Sorry, individual choices, behaviors, outcomes. That was the main lens for a long time.
So what was sort of missing there? What pushed this change?
Well, the big limitation was it often missed the forest for the trees, you could say.
Yeah.
The big change now, the paradigm shift, is towards this structural orientation. It basically means you just can't fully grasp why someone is healthy or sick without looking at the bigger social context, the structures they live within.
And how do we even measure that? Structure seems so big.
Well, that's what's revolutionary. We have new tools, things like hierarchical linear modeling. Let us see how different levels, personal, community, national, all interact. And biomarkers, too. Actual biological indicators in our bodies that show how social stress or, say, environmental factors physically get under the skin. It makes the impact of structure much more concrete, you see.
Okay. But I've also heard this has stirred things up a bit. Some scholars calling foundational theories like functionalism or conflict theory zombie theories. What's that about? Are they saying theory is dead?
Oh, no, not at all. It's definitely not that theory is dead. Far from it. It's more that those specific older categories maybe don't fit as neatly anymore. The field is actually thriving
Yeah.
because it's going back to really grapple with social structure. These new methods are helping us see those structural forces in action, how they shape, individual lives and health.
Right. So the focus on structure, aided by these newer methods, is actually breathing new life into theory, just maybe in different forms.
Precisely. And it's leading to some really powerful middle-range theories that help explain specific links between structure and health.
Okay, let's get into those. Where should we start? Maybe fundamental cause theory.
Yes, that's a cornerstone, developed by Link and Phelan. The core idea is that social conditions, especially things like socioeconomic status, SES, aren't just related to health outcomes. They argue SES is a fundamental cause of disease.
Meaning, what makes it fundamental?
Well, it has to meet certain criteria. It needs to influence multiple diseases, not just one. It has to operate through multiple risk factor pathways. It also needs to persist over time, even when specific diseases or risk factors change. And crucially, it involves access to resources, money, knowledge, power, social connections that people can use to protect their health.
Okay, that makes sense. Can you give an example?
Sure. Think about that study comparing two diabetes clinics. One, Park Clinic, served mostly higher SES patients. The other, County Clinic, served mainly lower-income minority patients.
Oh, right, I remember reading about that.
Patients at Park Clinic had way better continuity of care. They could afford insulin pumps, their jobs often had refrigeration for insulin, flexible hours for appointments.
Resources.
Exactly. Resources linked to their higher SES. Meanwhile, at County Clinic, patients faced huge barriers. Financial stress, jobs without sick leave or refrigeration, less stable social networks.
And that directly impacted their health.
Absolutely. Those structural constraints led to much poorer glucose management. It wasn't just about individual willpower, it was about the conditions they lived and worked under.
A very clear illustration. Okay, what's another key theory in this structural shift?
Medicalization theory is another big one. It looks at how problems or conditions that weren't originally seen as medical issues become defined and treated as such. Basically, medicine takes jurisdiction over a wider slice of life.
And it feels like the things driving that have changed too, right? It used to be maybe mostly doctors.
Exactly. The engines of medicalization have really expanded. Now you have biotechnology companies, the pharmaceutical industry, especially with ads directly targeting consumers.
Oh yeah, ask your doctor about. You see those everywhere.
Right. Plus consumer demand itself. And even genetics plays a role now. Think about conditions like hyperactivity in kids becoming ADHD.
Or short stature, or male pattern baldness. Things that were once just variations of normal are now framed as treatable medical conditions.
Precisely. It changes how we understand health, illness, and even just being human.
Okay, one more. What about health lifestyle theory?
Ah, yes, Cockerham's theory. This one focuses on collective patterns of health-related behavior, so diets, exercise, smoking, drinking. But the key is that these lifestyles are based on choices, yes, but choices that are heavily structured by life chances.
Life chances meaning things like social class, age, gender, race.
Exactly. It's this constant interplay, a dialectic between structure and agency. Structure provides the context, the resources, the constraints, and within that, individuals make choices. But the choices aren't entirely free.
So it's not just about individual discipline or knowledge, it's about what options are realistically available or encouraged within your social group or class.
That's the core idea. Higher SES groups, for example, generally have healthier diets, more access to safe places for exercise, maybe better ways to cope with stress. Their choices for a healthy lifestyle are enabled or constrained by their position in the social structure, their life chances.
So it connects individual behavior back to the larger social patterns.
It does. So you can see theory use is actually booming in health sociology. There's this clear momentum towards understanding how these broader structural forces really shape health outcomes across the board.
It definitely paints a different picture than just focusing on individual responsibility.
Yeah, it really does.
So maybe the thought to leave everyone with is this. Take a moment and think about your own health journey, or maybe the health of people in your community. How much of it might be shaped less by those moment-to-moment individual choices and more by these larger, often invisible social structures we've been talking about? What patterns do you notice? It's something worth considering.